Oh my gosh. I'm not gonna have time to read this. Oh my.
Hey.
Hey, Trey. Oh, I mean, Adrian, I'm sorry.
How do you get that? Oh, sorry, Paul. Oh, Bell said we got 10 minutes to recheck.
10 minutes?
So we have time to practice?
Yeah, we got it. I'll practice with you.
Second time's the charm, right? Can't fail it twice. Yeah, I think so.
Hey girl, you got check-offs today, don't you?
Yeah.
Well, good
10
luck.
minutes to practice.
You're gonna do great, I promise. Do you want some help checking off, like practicing?
Yeah, this is my second time doing it.
Okay,
I
let's
failed
go.
it the first time.
Alright, we can do it. Hey, you got this. You're gonna do great, okay? You're gonna do so good.
I don't know.
You're gonna be a great
I don't know. I didn't have time to practice over the weekend. I don't know. This is a hard checkup.
Hey, you're gonna be okay. We're gonna do it. Here's the movie. Alright, to this check off, you know we need the drape that goes on their chest. We need the tape to secure it. You gotta have your sterile gloves. Do you wear a size large?
Yeah.
Yeah. Okay, perfect. Alright, and then you have your kit, okay?
Okay.
Alright, so what do you do first? Let's go ahead and let's open the kit first. How about that?
Okay. Morgan, I don't think I'm gonna pass this check off.
You're gonna pass it. Here, let's use this side. It's probably a little bit easier. There you go. You're gonna pass it. You're gonna be a great nurse. Just take some deep breaths. You're okay.
I don't even know where to start. And today is the rechecks, and I don't even know where to start.
All right, you're good. You've done it once. You've done it a million times. You've done it. You know what you're gonna do. You're gonna do so good. I promise. All right, so we open it up.
Right.
And then we open it up, or we need to find the basin, right? So we have the basins on this side. We gotta.
A basin?
Yeah, we put the water into suction.
I'm gonna fail.
All right, let's restart. Let's just take a breath. Let's talk about it. What are you worried about?
Everything.
Everything?
I did not practice. I didn't practice at all. I was so busy focusing on the exam.
Yeah.
I didn't have time to practice.
I know you have a lot going on right now. Let's just take some deep breaths. Do you want to get my skill sheet and we can look over it one more time?
Yeah.
Okay, I'll go grab that.
Okay. Okay, Tawana, just breathe. You got this. Open the package. Take the cup out. Yes. Good, good, good. Whew, okay. Don't panic. Don't panic. Oh my God. Oh my God. Whew. Okay, open the water. Open the water. Yes, yes, yes. Okay, so now we're gonna pour it. Stop shaking. Stop shaking. She said I'm doing good, but I honestly don't think I'm doing good at all. Like, I think she's lying to me. Okay, the gloves. Just stop shaking. Take the gloves out of the package and open them and put them on. It's not that hard. Stop shaking. Oh my gosh. I don't think I can do this. There's no way I can do this. I can't even stop shaking. Okay, okay. It ripped. It ripped. Oh my God. Okay, okay. Just open the other pack. Just open the other pack and let's start over. Let's just start over. Okay, open it. Stop shaking. How many times do I have to keep telling you this? You're not going to pass if you keep shaking. Okay, now put the it's stuck to the paper. It's stuck to the paper. This can't get any worse than this. Okay, we got it on. We got it on. Let's put the other one on. Okay. You know, it's a little messed up. We can fix that. It's okay. Let's fix it. Let's fix it. Okay. All right. Okay. 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 Okay, we're getting the gloves. We're getting somewhere.
Tawana, Miss Bell said you're first.
Huh?
She said you're first to recheck.
Yeah,
Are you serious?
Yeah, you're
It
in
just
group
came
one.
through on the WhatsApp.
Are we in real life right now? Did she really say that?
You're in group 1.
I'm group 1.
Yeah, you're the first to go.
I'm after you though.
Yeah, and I'm next. Do you know if we lube the artificial airway for the check off?
Alana, I don't know. This is not the time to ask me any questions, okay? I'm like the first on the check off, and I don't even know what I'm doing.
But I don't know either, and I just thought you knew. Like, will you let me know after you
No,
get
I
out?
don't know. I'm only gonna fill out once I get out. I don't know what to do. Adrian, leave me alone. Leave me alone.
Hey girl, you're gonna do good, okay, I promise. Alright, just ignore them, you know? Let's just close the door.
Hey.
You're gonna be good. Alright, you know what to do? You know the steps.
Morgan,
Yes.
she already asked me questions about lube. Ooh, I didn't even know that we had to use lube.
Yes, you do. You're just getting worked up. You know what to do. Alright, let's take some deep breaths. Ready? You ready those 4, 7, 8 breaths they taught us? Alright,
Yeah.
breathe in. Hold it. Alright, you're gonna be great, I promise, okay?
How are you so happy right now? This is a stressful situation. Like, my career is on the line, Morgan. Like, I want to be a nurse. I dreamed of this.
You're going to be a nurse, okay? I promise. We gotta tune all that stuff out and just take some deep breaths, okay? We're gonna do good.
I'm
You're
trying.
Gonna do great.
I feel like I'm gonna pass out. Like,
Hey, let's sit down. Let's sit down. Come on, let's take a breath. Alright, you feel okay?
no.
Alright. You're gonna do great. You know what you know. You've practiced this so many times. I know you know how to do it, okay?
I don't think so.
You do. Positive thoughts. You gotta see the good, okay? See the
I'm
good.
trying, I'm trying.
You know it.
Morgan.
You got it. Let's go, girl. You got it.
Hey, how'd it go?
They told me they would let me know. I don't know if I passed or not.
Well, it is the second try.
Is that the checkoff sheet?
Yeah.
Can I see it?
Yeah, of course. Maybe they just want to make sure, like, if it's the second try, they don't want to just fail you out.
Alana, they told other people that they passed, but they told me that they would let me know. So, I don't think I passed.
Well, maybe they're just covering all their bases, you know?
Did you put the lube on?
Nobody put the lube on. Why do you always have jokes? This is not the time for joking because this is my second time. I'm trying to pass.
Like that?
I don't have time to joke. Alana, should I just leave now and avoid the embarrassment?
No,
Because I don't want everyone to see me, like, get kicked out of the program because they're going to talk about me.
No, they're not going to talk about you. They're just
Look,
probably
you're
just
over-exaggerating. You'll be
verifying
fine.
the
You'll be
paperwork.
fine.
I won't be fine.
Yeah, they're just talking for second opinion.
I was shaking so bad.
You're always
that
shaking, Tawana.
I don't know if I contaminated my sterile field or not. There has to be a reason why they said that they would get back with me.
They just want another.
No, Adrian.
Okay.
Just because you pass every check off doesn't mean everybody else does.
I don't
think I
pass
passed
every
this
check
one.
off.
Okay.
You're overreacting. I think you need to calm down.
Hey,
Just
it's
stop
the
talking.
second try. Yeah,
Just stop
give her-
talking.
Give her some time. Yeah, maybe they're just going over the rubric just to make sure, like, you don't get failed for no reason. Maybe they're just talking it over. I wouldn't leave.
I don't even think I'm gonna be a nurse anymore. The anxiety is not worth it. It's not worth it.
It's just school, like, you
My
gotta
heart
do
is
it.
beating so fast.
Well, let's try to take some deep breaths.
I just need time to myself. You can have these papers back.
Adrian, why would you do that?
She's gonna be fine.
It is her second try, though.
She passed. Don't worry. She always passes.
Yeah, I guess so. Oh, Tawana. So we did decide to pass you for your checkoff, but we are gonna have to do some remediation. And I do have your remediation plan in this folder.
Okay.
And I'll just need you to complete the remediation a month from today. And any questions you have?
Do you know what I can maybe do about my worrying? Like, I'm just always worrying. Like, no matter what, I feel like that is, stopping me from passing a lot of things.
Yeah, I've noticed you are kind of shaky with some of the checkoffs. Have you ever talked to your primary healthcare provider about that?
No, I just thought it was, normal. I'm like this all the time. I just thought it was, just a part of who I am, I guess.
Yeah, well, nursing school is stressful, but I would recommend maybe going to your doctor to see if they can get you on something or help you figure out how to cope better with the stress. And even try talking to your classmates because they know what you're going through.
Okay.
And they might have alternative coping mechanisms that work for them. So, yeah. All right. Well, it was nice seeing you.
It was nice meeting you
Okay.
too. Thank you.
You're welcome.
Hey, so how'd you do on the test?
I passed.
Yeah?
I made an 84. You know.
Okay. Oh, did you pass the checkoff?
Yeah, I passed it. You know, even though with all the worry and all the stress and stuff, I still passed it. You know.
Yeah, well, that's part of nursing school. It's just a season. You gotta get better.
Yeah.
Definitely gotta get better.
Yeah, I'm still a little, you know, worried because we still have more things to do. You know, all the worry and stuff. You know.
Speaking of which, hey, what's the next test about? Like tomorrow?
It's about schizophrenia, I think. Yeah, it's in the psych book, all in the psych. Oh,
Sorry, y'all. I got a phone call. I'll be quick.
Okay.
hey girl, how you been?
Hey, I'm good. How are you?
Good, great. Work's going good. How's school for you?
It's okay. You know, actually, my instructor told me that I should get screened for anxiety because, you know, it's like kind of messing up my functioning. You know, so I think I'm gonna go to the doctor. I don't know though. I'm kind of scared of doctors.
Well, I
You
can
know.
always go with you if you need, because like it is something important. You don't want to fail out because you're just anxious.
But you know, like, what if they say it's like more than anxiety? Like, what if they find a tumor or something? You know, I'm just scared.
I think that's the anxiety talking. Maybe
I
we
don't
should
know.
just maybe we could go and we'll just see what they say to you, and I'll be there for moral support. And if it is a tumor, at least you'll have a friend to support you.
You'll go with me?
Yeah.
Okay, that makes me feel better. That makes me feel better.
Yeah, no. So whenever you're free, like, just let me know and we can try to plan it out. And we'll go up there.
I'm thinking about going later today.
Later today?
Yeah.
Oh, yeah, I can definitely go with you. So, yeah, like, I don't know. I'm good. I'm free today. I just plan to hang out with you. So,
Okay, cool.
yeah.
Miss Jordan? Hey, how are y'all doing? Good. Just right this way. Alright, right this way. You can just sit on the table, and if you want your guests, you can sit in that chair right there.
Thank you.
Alright, how are y'all doing today? Good? So what brings you in today?
Just some anxiety. It's kind of hard to go day to day. You know, I've been having some muscle tension because I'm just so stressed. Yeah, I don't know. I'm nervous. I'm sorry.
It's okay, no, that's understandable. So let's go ahead and get some vital signs on you, and we'll start from there. Okay? Hey guys, how are y'all?
Good. How are you?
Good. Alright, I'm just getting some vitals on you. Can you verify your name and birthday for me?
2012.
Okay, perfect.
Yeah. Why do you need to know that?
Just so I make sure I have the right patient.
Okay.
So this is something we do for every patient. We check our vital signs in everyone just to get a baseline, so we can have that documented and like keep it in the chart. So if you're here at a different time and your vitals are higher or lower, we can compare those.
Okay.
So I'm gonna put this blood pressure cuff on your arm. It's just gonna give you a tight squeeze. Alright, there you go. And then I'm gonna go ahead and put this thing on your finger. It's called a pulse oximeter. It just checks how much oxygen's in your blood. So just give you that squeeze and check your temperature. All right, thank you. 96.8, that looks good. So I do see your heart rate and your blood pressure is a little elevated.
Does that mean that I am gonna have a heart attack?
Oh, no.
Would that be
So
related to the stress?
I think so, yeah. Especially since you said you come in for anxiety, that could be related, to just being a little anxious. But there's nothing to be worried about at the doctor. You just take some deep breaths.
Okay.
But the doctor will be in here soon to check you out.
Okay.
So this is something we do for all of our patients that present with anxiety. We do this little screening. So I'm just gonna ask you a few questions. Are you okay with your friend being in here?
Yeah, that's fine.
Okay. All right. So this is gonna be a scale. It's gonna go from 0 is not at all. 1 would be several days. 2 is more than half the days, and then 3 is nearly every day within a 1 week period. Okay.
If I answer these truthfully, are y'all gonna think I'm crazy?
No, not at all. No.
Okay.
We want you to be truthful so we can figure out the best treatment plan for you. Okay? Alright, so over the last 2 weeks, how often have you been bothered by the following problems? And on that scale. So on that scale, have you been feeling nervous, anxious, or on edge? Would you say not at all, several days, more than half the days, or nearly every day?
Every day.
Every day? Okay. Alright, so are you not able to stop worrying or control your worrying?
I can't stop it. It's just all the time, every day, 24/7.
All the time? Okay. Alright, are you worrying too much about different things?
Yeah.
Yeah? So it's not just the same thing you're worried about?
It's just like my health, it's school, it's work, it's just, I'm just on the edge all the time.
I'm sorry to hear that. Well, hopefully we can work together and figure out something for you.
I hope so.
Are you having any trouble relaxing? Like, can you find anything you find pleasure in?
Well, my muscles have been very tense. Like, I'm just always stressed, so it's kind of hard for me to sleep sometimes. So, I don't know. I've just been having some aches and stuff.
Yeah. Do you have any outlets that you like to do? Maybe like gardening or, sitting on the couch watching TV, spending time with your family, some people like shopping, things like that?
I like to walk.
To walk?
Yeah.
And that helps clear your mind?
It does.
So how often do you walk?
Probably every day when I feel like my anxiety is not under control. I can't control it.
So would you say you have trouble relaxing several days, more than half the days?
More than half the days.
More than half the days, okay. Are you ever so restless that it's hard to sit still?
Yes.
Yeah, okay. I can see that in your body language right now. Do you ever become easily annoyed or irritable?
Yes.
So would you say nearly every day, more than half the days?
I would say more than half the days.
More than half the days, okay. And then my last question for you, do you ever feel afraid that something awful is going to happen?
Oh, yes.
Okay. How?
Like, right now, I feel like y'all are gonna admit me to like a mental place because you think I'm crazy.
No, we do not think that at all. We want to help you and figure out the solution that's going to help you feel better, okay? So would you say that you're afraid that something awful is going to happen several days, more than half the days, or nearly every day? Every day? I'm sorry. All right. So I do have this screening for you. We're gonna show the doctor this, and hopefully we can figure out a plan. Okay. Do you have any questions you need to ask me right now, or?
I don't think I have anything.
No. Okay. All right. Well, just take a breath. Relax for a little bit. I'm gonna talk to the doctor, and we'll figure something out.
Thank you.
You're welcome.
I think they're gonna admit me. I think they think I'm crazy.
No, they're not. They're just trying to make sure you get
She asked me all those questions. She is going to get ready to shit
She
me
said
off.
they do that with everyone with anxiety. They're just trying to measure out how bad your anxiety is. They're not gonna
Well, I
shoot
told
you.
you we should have came here. That's why I don't like to come to doctors because they don't know what they're doing.
They're just trying to help you to make sure that you can go through your day to day, do your tests and check offs without worrying all day long at night.
That something's gonna happen. I know something's gonna happen.
Hey, Dr. Cruz, how are you? So we have this patient. She just came into the office. Her name is Tawana Jordan. She's a 22-year-old female. She presents with possible anxiety. You could tell that she was very shaky. Her voice was trembling. Her shoulders were really tense. Her legs were just very restless. You could tell it was visible anxiety. Her vital signs were her heart rate was 117 and her blood pressure was 138/90. Everything else was regular.
Showed fever?
No, she did not. It was 98.7, I think. She said when I interviewed her, she said it was very hard to do her day-to-day activities. She was just very nervous. Like I said, she was very tense. I did the screen on her, and the generalized anxiety score with the GAD-7, and she got a score of 19, which was, that's pretty high. So, what do you think we could do for her?
I'll go talk to her. But like you said, it sounds like she's going through stuff, has anxiety. She has anxiety. What we could do after I talk to her, probably get her on 5 milligrams of buspirone twice a day, and start her on propranolol as well, 20 milligrams PRN.
Okay. Do you want to do both those are PO, right? Since she's gonna take them
No,
home.
the buspirone is both for PO.
Okay.
Jot down there to also get her to just start some other activities, stuff like that, some exercise, music.
Like some different types of therapies?
Yeah.
Okay, I was thinking like some therapy she could use. Maybe you could refer her to like a talk therapist or a dialectical behavior therapist.
Yeah,
I think that'll help, get her feelings out.
Sure, I'll get a referral.
Okay. I was also, both of us could go in and talk to her about it, but like some family interventions. What do you think that like her family could do to help her out? Maybe just like.
Yeah, we'll talk to her again, get her family on board as well. You'll probably just tell them to just calm her down when she's anxious, have her take some deep breaths, take her PR medications, make sure she doesn't forget that she has them or anything like that.
Yeah.
Just make sure that she sticks to the regimen that we give her.
Yeah, I agree. So you're gonna go with her prognosis. What do you want to like diagnose her with?
She has generalized anxiety disorder.
Okay. I had written a nursing diagnosis, so I just wanted to share it with you, just make sure you agree with it. So I have anxiety related to excessive worrying and extreme fear as evidenced by restlessness, muscle tension, difficulty breathing, tremors, and verbalized worry.
Okay, yeah, that works with me.
Sounds good? Okay. All right, I'll go talk to her. Thank you, Doc.
All right. Hello.
Hey, guys.
Hello.
Hey, Tawana. This is Dr. Cruz. He's our doctor for the office.
Hi, how are you?
I'm good, how are you?
What's your name?
I'm Alana, I'm your friend.
Nice to meet you. Okay, so what seems to be going on?
Well, I've just been having some anxiety, muscle tension. I'm forgetting things. It's kind of hard to, go through my day to day without, just worrying all the time. And, it's just too much. It's too much.
Do you have any times when your anxiety flares up more than other times?
Yeah, I'm in school, so it kind of.
Oh, what's your school for?
I'm gonna become a nurse.
All right. I'm gonna go ahead and take a listen to your heart, okay? All right. All right, take some deep breaths. Deep breath. All right, lean forward for me. Take a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, your breathing's fine.
Did you find anything wrong with me?
No, your heart rate's a bit fast, but that's normal. You're feeling anxious. So overall, you're fine. You're gonna be okay. You told me you were feeling anxious about school, about many different things, right?
Yes.
Okay. So it seems to me that you have generalized anxiety disorder. So what that means is that anxiety really hits you harder than most.
Is that normal?
Well, for your arrangements, yes. Also, a lot of environmental factors can, cause generalized anxiety disorders, such as, school, job changes, different things like that. You take any meds?
Not right now. I just take like Tylenol for headaches and stuff.
Okay. Well, another predisposition is that you're a female, so also depends on your personality as well. Sometimes are you fairly negative, would you say, or you usually try to keep positive thoughts?
I try to keep positive thoughts, but the negative thoughts kind of, they kind of win sometimes.
Okay, I understand. All right, so what we're going to do is we're going to refer you to a therapist to get some talk therapy in, as well as some cognitive behavior therapy. We're going to start you on some medication. It's called buspirone and propranolol. All right.
What do they do?
So buspirone is also known as Buspar. It's an anti-anxiety medication. It's not as strong as other medicines. They're also known as like SSRIs. This one's a little bit not as strong, so we're gonna start on a lower dose and work you up a little bit higher. So this medicine helps with your anxiety in total. It's strictly anti-anxiety. It's not a mood stabilizer or anything. So this medication, it takes a little bit longer for it to work. The onset's about 1 to 2 weeks. So if you don't feel immediately like this relief of those symptoms immediately, just keep taking the medicine. It's going to take time for it to work, but it's going to help you out.
Okay.
But he said he's going to prescribe you some propranolol. That's also, it's for your heart. It's called a beta blocker, but it has the side effect of an anti-anxiety as well. So it's something you can take when you're stressed. So say if you're going to do your checkoff, or you have to do something that causes you some more anxiety, you can take this medicine immediately and you'll have those relief of symptoms within 30 minutes or so.
Okay.
Does she have to take that for the rest of her life?
So these medicines are something that you can come off of, you know, with these therapies that he's going to refer you to, or a different community or family outreach. They can help like lower your symptoms. So no, not necessarily. I mean, some people are, but you know, it's different with everyone. So we can reevaluate you in a few months or weeks and see how you're doing, and if we need to adjust the therapy, we can.
So maybe after school she could get off, because I know that's a large part of your anxiety, right?
Yeah, that's a
For
huge
now,
stressor
for
for
now, what
you.
we're gonna do is keep you on the bus part. As for the propranolol, just take it, like she said, 30 minutes before. Anytime you have some big exam or something going on, maybe, I'm sure, I assume you're doing clinical as well, right?
Yeah.
Probably take them before that in the morning as well. Yeah, and that's what we'll do. I went ahead and printed out some discharge instructions if you wanna go ahead and get them.
Okay, yeah.
All right, do you have any questions for us before I go?
No, I think that's it. I mean, y'all aren't gonna ship me off or anything, right?
No, not at all, no.
Okay.
Just take some deep breaths and you'll be fine, all right? All right? All right.
So we're gonna get some discharge instructions for you. We'll be right back, okay?
But you did have a tumor.
All right, I'm back again. I've got these discharge instructions.
Okay.
So Dr. Cruz gave me these printed off for you, but I'm just gonna go ahead and give you the general rundown. So, do you have any questions on like general anxiety disorder?
Is it forever?
It could, like I said, it could be forever, but it's something that you can use with, you use therapies or those different drugs that can help you cope with those symptoms.
Okay.
So, you know, like you said, you're having problems, you know, doing your day-to-day activities, you know, you feel anxious about school and things like that, but that's something that comes with this disorder. But these medicines can help you. An increased risk, like you said, is the work and school stress. You don't have any comorbidities, but also your age and your gender is a huge factor. This prevails in people 20 to 30 years old and that are women. You know, we can't help, we're just worry words. So you have those signs and symptoms that come along with general anxiety disorder, which is the fatigue, the shakiness, the muscle tension, the tremors, the palpitations, all the things. So we diagnose this by talking with you and figuring out your tremor or triggers, and you know, doing that screening that we did earlier. So that's the conclusion we've come to. But we have different therapies and medicines that we had previously educated you on. If you have any questions, you can ask now, or you can always call our office and we can give you some more instructions on them.
Okay.
So what you can do to manage it is you can just, you know, continue to talk to someone. You can use your friend, or if you would like to go to the therapist that we refer you to, that's a good option because, you know, they are professionals. But keep doing the things you enjoy, like going on your walks. I think that's really good. Exercise is great for the mind and mental health, you know, get the serotonin going. You can do some practice the deep breathing, like I had mentioned earlier, you know, this 4-7, or I think someone had mentioned earlier to you, the 4-7-8 press. That help calm you down and just get your mind in the right place. If there's anything you need, you might want to call your doctor if your symptoms aren't getting better. You know, like I said, it's going to take that 1 to 2 weeks, but if, you know, you come to your checkup and you're still not feeling any better, you can always talk to the doctor and we can either up your dose or change the medicine or do something like that. Or if you have any worsening symptoms or any questions, you can always call your doctor or the office.
Thank you.
Yes, ma'am. Have a good day.